Thank you very much. I want to thank both of you for some really important comments that force us to think hard about some of the questions you want to address here. I want now to turn to the two co-chairs of the workshop organizing committee, and I want to recognize the committee for all of the work it did in putting together this workshop. There are 10 members, and I won't list all of their names, but simply ask the two co-chairs, Jim Hughes and Mary Wilson, to provide an overview and some comments to open up the next sessions of the meeting. So first, Jim Hughes.
David, thanks very much. I'd also, on behalf of myself and Mary Wilson, thank the Planning Committee for outstanding input into this meeting. As you've heard, we're going to focus on infectious disease transmission in the built environment with an emphasis on challenges and opportunities due to urbanization and slums. This is particularly timing given the demographic trends that we've heard about and also the projected proliferation of megacities over the next 20 to 30 years, particularly in low and lower middle income country settings. The plenaries very nicely set the stage for the discussions. We're going to move shortly into a session on drivers of transmission that's going to focus on gaps in knowledge and lessons learned from outbreaks and ongoing studies. Tomorrow morning, we'll start with another plenary that will focus on tackling health inequalities. We'll then go into a session where we talk about effective interventions and then conclude with what is going to be a very important component of the conference, and that is 3 different breakout sessions to which forum members have been assigned, and speakers and other attendees are welcome to pick the breakout group of greatest interest to them to join, and then we'll come back for a summary of those discussions and then open it up widely for questions, answers, and comments. Mary?
I'd also like to add my thanks to the members of the Planning Committee who have provided useful insights and recommendations for speakers. You will note that the program is ambitious and broad. We hope to explore new interfaces, new interstices. We hope that the meetings here will catalyze discussions, that this meeting will not be the end of some of these interactions, but these will lead to continued conversations and collaborations in the future. Some of this is conceptual, but we also very much want to see some concrete outcomes from the meeting. And I think that the breakout sessions tomorrow afternoon are going to be an opportunity for everyone to become personally involved in the discussions. And we will then be reporting back and discussing those in a plenary session. But it will be an opportunity to think not only about some of the conceptual issues, but to come up with some concrete suggestions, really think about interventions and potential policy interventions that may be useful in moving forward. I guess I am impressed in looking through the people who are participating. We have people from engineering, ecology, epidemiology, economics, entomology, slum health. I mean, it really is a wonderful mixing of disciplines, a group that do not necessarily come together. So we are hopeful that there's going to be really synergies here that will be useful going forward. Thank you.
Okay, so we are going to move into session 1 on social, physical, environmental, and political drivers of infectious disease transmission in the urban built environment. And we're delighted to have one of the Planning Committee members, Maria Gloria Dominguez-Bello from New York University, serve as moderator for the session. I think Maria Gloria will introduce the speakers as part of the session. I'll just ask that you all remember to please use these microphones because we are recording the comments, but also the discussion as well. in order to help generate proceedings from this meeting. So if you would just remember to use these microphones, identify yourself during the question and answer and discussion period. So without further ado, Maria Gloria.